As the NHS clinical commissioning groups for Surrey Downs, Sutton and Merton, we are responsible for planning local healthcare services across Surrey and South West London. In September 2019, we were allocated £500 million to improve the current buildings at Epsom and St Helier hospitals, as well as build a new specialist emergency care hospital on one of the three sites, Epsom, St Helier or Sutton. We are holding a public consultation starting on the 8th of January and closing on the 1st of April to find out what patients, carers, community and voluntary sector bodies, parents and guardians, children and young people, elderly people, health and social care professionals and the public think of our proposals. Epsom and St Helier hospitals are facing significant challenges, which we need to take action to overcome if we are to keep hospital services within the Surrey Downs, Sutton and Merton area for generations to come. There are three main reasons why we have to change the way we deliver local NHS services: quality, buildings, finances. Patients at Epsom and St Helier hospitals do not always receive the level of care that they need and deserve. Some key services do not meet the agreed national and regional clinical standards, including the doctor and nursing requirements that are best practice within the NHS. Nationally, there is a difficulty recruiting doctors and specialist clinical staff. This is a particular problem at Epsom and St Helier. Both hospitals provide many of the same services and run with gaps in their medical rotas and rely heavily on temporary doctors. It is clear that quality has improved at Epsom and St Helier hospitals, and the Care Quality Commission, CQC, the independent regulator of health and social care, has rated the hospitals a good. However, emergency services at the hospitals are still rated as requires improvement because of the poor buildings. Staff see and treat patients in buildings that are not suitable for modern healthcare. Not enough single rooms, patients moved between buildings with no protection from the weather, lifts are too small for modern beds, difficult to keep older buildings clean, as well as expensive to heat and repair. The hospitals are spending more money than they are given because of the way services are provided at both Epsom and St Helier hospitals, without enough permanent staff and in old buildings. A huge amount of money is spent on temporary staff to keep our hospital services safe. These issues will get worse if we do not address them, and the longer we wait, the more difficult it will be to keep services running. Because of the £500 million investment we have secured, under these proposals, the majority of services would stay at Epsom and St Helier hospitals in refurbished buildings, with both hospitals running 24 hours a day, 365 days a year, with urgent treatment centres at each hospital, as well as outpatient services, CT scanning, planned care procedures and hospital rehabilitation beds. We would bring together 6 major services for the most unwell patients, those who need more specialist care, and births in hospital onto one site in new state-of-the-art buildings. This would mean that specialist doctors, nurses and clinical staff would be able to work together to provide round-the-clock specialist care. We have included births at the Specialist Emergency Care Hospital to make sure mothers and babies have safe, high-quality care. In an emergency, they need access to on-site surgeons and critical care. For women who are low risk and would like to give birth at home, we would continue to encourage and support them to do so. Our proposals would mean 85% of patients would continue to use a local hospital as they do now. We used 3 tests to come up with where we could locate the Specialist Emergency Care Hospital. These 3 tests produced 73 possible options, which we shortlisted down to 3 options. The location would keep major hospital services within Surrey Downs, Sutton and Merton. It would mean that we would have the right number of skilled and specialist staff to deliver healthcare services in the long term, and the site must be big enough for the specialist emergency care hospital services. There are 3 possible locations where we could bring together these 6 core services in a specialist emergency care hospital. This could be at Epsom, St Helier or Sutton hospitals. We have looked how many beds we need in the future. People in our area are getting older and our population is getting bigger. Medicine is changing. Technology is being used to shorten the length of time people need to spend in hospital. Epsom and St Helier hospitals have 1,048 beds now, and we have worked out we need 1,052 in the future. We have compared the 3 hospital sites. We looked to see if the proposals would improve safety and quality, improve patient experience, deliver the required beds, and solve the issues around workforce, recruitment, and keeping staff. We looked to see if it improved access to urgent and emergency care. We looked at what the effect would be on older people, people from deprived communities, and people from different equality groups. There is an independent report called an Integrated Impact Assessment on this on our website. We looked at how the proposals would fit with the NHS long-term plan and support bringing health and care services together. We looked at the effect on travel and carried out a travel analysis, which you can see on our website. We looked at how easy it would be to build and the effect on other local hospitals. And we looked at the costs. For all of the options, the time it would take the majority of people to get to the specialist emergency care hospital by car or blue light ambulance would not change. From the evidence we have to date, our preferred option is to locate the new specialist emergency care hospital at Sutton. It would allow us to deliver high-quality services for the whole population. It would ensure timely access for most people, as it is centrally located for where more people live. It would mean we have 3 urgent treatment centres. It would have less effect on older people and deprived communities than the other options. It would also be the quickest option to build. To see our comparison of the 3 sites in more detail, look at our consultation document on the website. We use different ways of involving patients, carers and residents across Surrey Downs, Sutton and Merton to make sure that as many of them as possible were involved in developing and shaping proposals at an early stage. We reached over 1,500 people from a wide range of backgrounds. Online, 25,000 people looked at our video, visited our website and looked at our social media information. We have used what we heard from residents, patients and carers to help shape our proposals, changing the proposed opening times of the urgent treatment centres from 8 a.m. to 8 p.m. to 24 hours a day. We used what people have said to evaluate our proposed options, and we want to hear what you think. We won't decide what to do until after the public consultation, so please do have your say. We commissioned an independent report into the possible effects of our proposals. The report looked at effects in different areas. This has helped us to further develop our proposals. Another version of Integrated Impact Assessment report will be published after this consultation to give decision makers more information. We are keen to hear your views on our proposals, how they would affect you and your family, what worries you, what you like and do not like, if there is another solution we should consider, and if there is anything else you would like to tell us or think that we have missed. To find out more, get in touch. Consultation documents, information in different formats and other documents are available on our website. None of the 6 services would be brought together until the new specialist emergency care hospital is built, which, under the preferred option, would be 2025 at the earliest. The feedback from the consultation will be independently analysed by Opinion Research Services, and a report will be produced and published on our website. We will share the report with stakeholders, including with the Joint Health Overview and Scrutiny Committee, so they can give their comments. The CCGs will jointly consider these comments, the report on the consultation, the final integrated impact assessment, and any other evidence before making any recommendations or taking any decisions. There are many different ways to have your say. Fill in the questionnaire online, come to any of our local listening events to tell us your views, email us at hello@improvinghealthcaretogether.org.uk, message us on Twitter, or visit our Facebook page. Write to us at Opinion Research Services, Free Post SS1018, PO Box 530, Swansea, SA1 1ZL. Call us on 02038 800 271. Send us a text message to 07500 063 191. We are confident that these proposals will improve the quality and safety of the care we can provide for generations to come. Please talk to us and tell us what you think of these proposals. We are listening.